Welcome to the Silica Exposure Training for the cut stone industry. This training covers the identification, evaluation, and control of silica exposures in cut stone and stone fabrication industries. The training was developed by Georgia Tech's Safety, Health, and Environmental Services Group with funding from the U.S. Department of Labor's Susan Harwood Training Grant Program. This is Lesson 2, What You Need to Know About Working with Cut Stone. In a 2020 survey of 2,014 homeowners seeking to remodel their kitchens, the number one countertop material of choice, as reported by 40% of respondents, was quartz countertops made out of artificial or engineered stone. Engineered stone or quartz countertops are marketed to consumers as durable, scratch-resistant surfaces that are less likely to stain and require no need to seal or reseal. Unlike natural stone, engineered stone provides consistency and uniformity, and the non-porous design makes it less prone to bacterial growth. Because the material is manufactured using primarily quartz rock, it is made out of abundantly available material, and because it is not entirely made of stone, it is lighter than natural stone products. What is more, once installed, the countertops can become a permanent, non-toxic fixture in the home. However, there is growing documentation of outbreaks of silicosis cases and other work-related conditions among employees involved with the manufacturing and fabrication of engineered stone countertops in Italy, Spain, Israel, Australia, the United States, and China. These cases of silicosis are noteworthy, not only because of the volume of cases, but silicosis cases are being diagnosed in much younger workers after shorter than usual exposure intervals compared to other industries with exposure to crystalline silica. Like we covered in Lesson 1, engineered stone contains about 90% crystalline silica content. The basis of quartz stone bound together with a polymer resin, resulting in much higher exposure concentrations than those produced from natural stone. By contrast, granite contains only 30% silica content, and marble contains only 3% silica content. Attention to the outbreak of this disease among countertop fabricators and manufacturers drew international attention after the Australian government in Queensland intervened and developed a screening program for all affected current and former employees in the industry, after several researchers and physicians sounded the alarm and recommended the development of a health surveillance program to promote the early identification of disease among those who are asymptomatic. By 2021, 23% of workers screened in Queensland by WorkCover had been diagnosed with a work-related disease, with 206 of the 1,053 individuals screened being diagnosed with silicosis. So this means that out of every 5 workers, 1 will suffer from an illness resulting from exposure to silica. A 2019 Morbidity and Mortality Weekly report published by the Centers for Disease Control and Prevention highlighted an outbreak of silicosis cases among stone fabrication workers in the United States. Public health professionals found 18 cases of severe silicosis and 2 deaths. Of these cases, 16 of the men are Hispanic and 2 are non-Hispanic African Americans. Several of these patients also had autoimmune diseases and latent tuberculosis infection. However, we do not know for certain how many cases may be out there, but may not been diagnosed because the U.S. currently does not require physicians to report cases of silicosis. Dr. David Michael was quoted as saying, "More cases will undoubtedly appear, since whenever this material is used, it has caused disease. The only reason the U.S. doesn't have many more cases is that no one has looked for them." The OSHA standard for crystalline silica has two limits. The first limit is called the action level. This means that if employees are exposed to levels of silica dust that is 25 micrograms per cubic meter or higher, the employee needs to take action and implement medical surveillance for employees, provide training about silica, and develop an exposure control plan. The second level is called the permissible exposure limit, or PEL. This is the limit that is considered the highest level that employees should ever be exposed to during a full shift. For silica, this limit is 50 micrograms per cubic meter. To give you an example of what amount of silica dust we are talking about, take a look at this penny and then look at the small amount of silica dust next to the penny. This pile of silica dust represents the levels we are talking about, which is a very small amount. From 2017 to 2021, consultants at the Georgia Tech OSHA Consultation Program have assisted 8 different companies that fabricate cut stone for the countertop industry. A total of 10 visits were conducted where monitoring was conducted for employee exposure to silica dust, collecting a total of 46 full-shift samples at these sites. Employees were fabricating a wide range of countertops, including engineered stone or quartz countertops. For almost all shops, the type of stone being fabricated varied day to day based on orders. However, the average amount of silica that employees were exposed to averaged 227 micrograms per cubic meter. This is 4.5 times the OSHA permissible exposure limit and over 9 times the action level for silica. When no controls were in place and employees were cutting, polishing, or performing other types of fabrication dry, the exposures were 34 to 46 times the permissible exposure limit and ranged from 1,700 to 2,300 micrograms per cubic meter of silica dust. However, even when companies implemented some form of engineering control by either using wet methods, ventilation, or both wet methods and ventilation, the exposures were still 2 times the permissible exposure limit and ranged from 9.6 to 370 micrograms per cubic meter. In fact, 86% of all samples exceeded the OSHA action level of 25 micrograms per cubic meter for silica. What this means is that water and ventilation did not reduce exposures below the action level or the permissible exposure limit when fabricating countertops due to the high silica content in engineered stone or quartz countertops. What this means is that employees working in the cut stone industry, especially if they are fabricating engineered stone products, are potentially at risk for respiratory health illnesses, such as lung cancer, chronic obstructive pulmonary disease, and silicosis. Infectious diseases such as tuberculosis, autoimmune disorders such as lupus, rheumatoid arthritis, and systemic sclerosis, and kidney disease. To prevent the development of these illnesses, employees fabricating stone that contains silica should receive hazard communication training for silica, be provided for and fitted for respiratory protection, be enrolled in a silica exposure medical surveillance program, and use tools fitted with water and ventilation to further reduce dust. Thank you for watching Lesson 2 of the Silica Exposure Training for the cut stone industry, a training on the identification, evaluation, and control of silica in the cut stone and stone fabrication industry. This material was produced under grant number SH37200 SH1 from the Occupational Safety and Health Administration, U.S. Department of Labor. It does not necessarily reflect the views or policies of the U.S. Department of Labor, nor does the mention of trade names, commercial products, or organizations imply endorsement by the U.S. government.